Okay, so once you guys clean up the skin, get it down to about lower ankle, I'd start at the medial surface. And right here, you see these two big flat muscles. Now, honestly, in human, they look much different. I'll show you on the animatage. But this is the gracilis. This muscle here is the sartorius. When you're doing your dissection, remember the sartorius kind of wraps around the top of the leg, so you want to try not to separate it off. Okay, but you'll cut through those, exposing some of the deeper muscles. And the first thing I look at before you start really kind of dissecting is find the veins, find the vasculature. It's a good landmark. Kind of clean up around it, kind of start lifting some of this tissue, and then below the vein, you have this little teeny muscle right here. And so that's part of it. That's the pectineus. This is actually all of it right there. There's pectineus. Then adductor longus. And then this is, some people separate it right here, but it's one muscle. That's the adductor femoris. So again, adductor just pulls the leg medially. Okay, now another name for the adductor femoris is adductor magnus. So if you're looking at the animatage, it might be adductor magnus, same muscle. Okay, then you have semimembranosus, semitendinosus. So once again, gracilis sartorius, pectineus, adductor longus, adductor femoris, semimembranosus, semitendinosus. Now, above these veins, right up here, kind of coming down from the abdomen, actually it's the vertebral column, is a muscle that's fused in cat. It's two separate muscles in human. And so this is the iliopsoas. Now I've separated it out, but classically it's said to be a fused muscle, but this would be like the iliacus, and this is the psoas major in humans. Because it's fused in cat, if I pin it, you will just name it as iliopsoas. As far as action origin insertion, either pick iliacus or psoas major for the action origin insertion. Okay, above that, so, or I guess below that, you have the vastus medialis, the rectus femoris, and then the vastus lateralis that kind of wraps the whole way along the surface. Setting just on top of that is this muscle. It's lifted here. That's the tensor fasciae lati. And so if we look at the lateral surface, it's a muscle kind of looks like, have knuckles here, finger pointing. That, all of that is the tensor fasciae lati. And it's connected to this great big tendon that covers the entire vastus lateralis, and there's some of the fasciae lati. There's tension on it. Okay, so vastus lateralis, then this huge muscle right here, that's all biceps femoris. If you start up near the back and work down, you can separate out a cat-only muscle, which is right here, called the caudofemoralis. So caudofemoralis, biceps femoris. We want to kind of open things up a little bit, and if you're real careful, you'll get this cat-only muscle right here. This is the tenuissimus, and then this is the sciatic nerve. And now what we're looking at below all of these, this is semitendinosus, semimembranosus, adductor femoris. So tendinosus, membranosus, adductor femoris. Okay. Now working up, following that cat only, all you have to do is name it, caudofemoralis. You then have kind of layered in, you have the gluteus maximus, and then above it, right here, this blocky muscle, that's the gluteus medius. So gluteus medius, gluteus maximus, caudofemoralis, biceps femoris, tensor fasciae lati, vastus lateralis. Open it up. You got the tenuissimus that, again, just identify. And then you have semitendinosus, semimembranosus, adductor femoris. So I could ask these three muscles from either side. Okay, now if I lift up this, going to the lower leg, if I lift up the biceps femoris, you're looking right at the gastrocnemius, that's the calf. Here's the other part of the biceps femoris. Now kind of pull that over. Here we're looking at, again, the gastrocnemius, and then here's also the soleus. So actually when you say calf, it's two muscles. It's gastrocnemius and soleus. They both attach to the Achilles tendon. And then down to the calcaneus. Okay, across this gap, which you can clean up, are three muscles that kind of layer on top of each other. In some texts, they give it another name. They call this muscle the fibularis muscles. That's not well accepted in the scientific community. Someone just, I don't know why they changed the name. The better name, the classic name, is the peroneus. So you have the peroneus longus, which is right here. I come down to the tendons, and you can separate them that way. It's being, since I'm on video, it's not being helpful. There we go. So there's the peroneus longus. So it's all of this muscle right here. Below that is the peroneus tertius, which is right here. Next little tendon. So there's the peroneus tertius. And below that is the peroneus brevis. So we have longus, tertius, brevis. Okay. Another gap. And then it's kind of a cleft here. The most anterior muscle is the tibialis anterior. The muscle that's kind of under it is it's on the outer surface, the lateral surface, that's extensor digitorum longus. Last muscle, follow down, there's the tibia, and then right here, tibialis anterior, and this is medial, so just like on the arm, this is flexor digitorum longus. Don't get confused with the flexor and the extensor digitorum longuses, so that they don't mix it up with the flexor digitorum communis and lateralis. Just remember longus leg, so L and L. So if it's a longus, it's always going to be in the leg, the others in the arm. So for example, your flexor digitorum profundus, extensor digitorum communis, extensor digitorum lateralis, all on the arm, extensor digitorum longus, flexor digitorum longus in the leg. That's it.